New York State is a state that since 1993 has already had regulations about preventing insurance companies from denying you insurance because of pre-existing conditions. And as such, because it had no mandate, insurance rates were particularly high in New York if you didn't get employer-based insurance. Well, according to the New York Times, a study done out of New York, the governor announced on Wednesday that individuals buying health insurance on their own will see their premiums drop by at least 50%. State insurance regulators say they have approved rates for 2014 that are at least 50% lower on average than those currently available in New York State. Beginning in October, individuals living in New York City who pay $1,000 a month or more for coverage will be able to shop for health insurance for as little as $308 a month. With federal subsidies, that cost will be even lower. Now, I haven't seen this study. This is just the report from the New York State, and we're going to hear more about this as we go forward. And note that the new premium rates will not affect the majority of New Yorkers because most of them get their insurance from either their union or from their employer. Only those who have to purchase it on their own. Because the cost of individual coverage has soared, only 17,000 New Yorkers currently buy insurance on their own. About 2.6 million are uninsured in New York State. State officials are estimating as many as 600,000 individuals are going to buy health insurance on their own in the first few years the health law is in effect. 3/4 of those people will be eligible for subsidies available to lower-income individuals. Here's an example. Now, you know that in these exchanges, and New York State is setting up its own exchange, there's a platinum, gold, silver, and bronze level of coverage. Different amounts of coverage, different levels of deductibles, et cetera, et cetera. An individual with an annual income of $17,000 will pay $55 a month for Silver Plan, which is the third level from the top. A person with a $20,000 income will pay about $85 for a Silver Plan. Someone earning $25,000 will pay about $145 a month for a Silver Plan. Younger people probably will end up getting a bronze, which would be closer to akin to probably a catastrophic health insurance plan. Those least expensive plans may not offer as wide of access to different doctors. And on top of that, people who are making less will be eligible for subsidies, which will reduce those rates even more. Small business will be eligible for tax credits and should enhance their ability to provide health insurance. So this is a big deal if these numbers bear out even half of what they're promising in this report. So that's good news for those of us in New York. Those of you in Texas are a little SOL, as it were.